Mrs. Maria was received at the office yesterday. She arrived desperate because she had facial paralysis and had already been to the ENT, maxillofacial surgeon, neurologist, neurosurgeon, and still didn't know which doctor treats facial nerves. Guys, the most important thing is to initially have a diagnosis. What is the cause of that facial paralysis? For example, Mrs. Maria had Bell's palsy, an infectious cause that does not pose a life-threatening risk to the patient. Be aware, as there are other causes of facial paralysis that can pose a life-threatening risk, such as a stroke. Alright, I received the diagnosis, already underwent treatment, there is no risk to my life, I just have facial paralysis. And now what do? At this moment, it is very important for you to have a physical therapist and a specialized medical team that performs surgeries for the recovery of the facial nerve. They are working on handling your case together. Why? Because the majority of patients will not require surgery. They will avoid the sequelae by doing the most correct treatment, avoiding shock, avoiding muscle contractures, avoiding kinesias. Hey, if by chance you have a serious injury that shows no signs of reinnervation almost a year later, or if you end up with severe sequelae that haven't improved even with physical therapy, then you do need a surgical procedure. When discussing facial nerve surgery, there are two distinct surgical procedures available. The reinnervation surgery involves transferring a healthy nerve to restore function in facial muscles. This innovative technique enhances muscle function by utilizing nerve grafts from other areas of the body. And late surgery, where we can't do a reinnervation because the muscles are already atrophied. In this particular situation, we typically transfer muscle tissue from a different site or implement various interventions to address issues like excessive wrinkling or synkinesis in the affected area. They are reconstructive surgeries that are performed after 2 years of injury. The most important thing here is to treat early, as nerve reinnervation surgeries have better outcomes. All right, doctor, I understood all that, but who is the best surgeon to perform this procedure? Guys, there is no neurosurgeon or plastic surgeon here. The best professional is the one who frequently performs this type of treatment. I'm Dr. Thomas Marcolini, a neurosurgeon specialized in peripheral nerves and facial paralysis, and I'm here to teach you a little about this type of injury and what to do in this delicate moment of life. If you like this content and have any questions, write them down below for me and follow my channel.